Methodist Hospitals, we have a mission to provide quality, compassionate health services to all those in need. To achieve our mission, we have a vision to be the best place for employees to work, for patients to receive care, and for physicians to practice medicine. In short, at Methodist Hospitals, everyone matters. At Methodist Hospitals, we take pride in the new, advanced treatment technologies we have brought to Northwest Indiana, and the growing list of awards and certifications we have earned. They are all evidence of the quality of care you can expect to receive. But the fact is that quality care, real care, begins and ends with people. People with values of integrity, compassion, accountability, respect, and excellence. Caring for the people, all people, in their community. Everyone matters. Everyone, whether or not they have contact with patients and their families, share those values. So, if you could see inside their hearts, what would you see?
Helping people, along with having great staff, but then also the opportunity to help people. Methodist has values, and the values kind of encompass I care, integrity, compassion, accountability, respect, and excellence. And that really embodies everybody that I work with.
I was actually born at the North Lake campus. My dad is a minister, and we used to sing as children in the chapel and then go down to the cafeteria to eat. So it was very rewarding that I'm still here and able to put back into my community.
I started at Methodist when I was 19 years old. So I've kind of grown up here, and I've had the opportunity to really grow here.
But one of the things that brought me to Methodist was just how friendly everybody was. You walk in, everybody smiles, everybody speaks to you, and it's really nice.
Methodist Hospital is a caring facility. Everybody comes together to pull their job in caring for the patients. You know, we all work together as a team, and that's what I like.
From housekeeping to the lab to the doctors to the CEO, everybody will take care of your loved ones like they're theirs.
When these older folks come in, I treat them like they're my mother and they're my father, my sister, my brother, so I feel like I already know them. And I make them feel the same way too, and just to be there just to help somebody. Disabled people on crutches and can barely get out the car and move, so that gives me the most satisfaction and joy.
I come here, I bring my family here. I've had, my mother's been here, my father's been here, and I am not a person that would ever take a relative to somewhere where I didn't think that they would get the very best care. And it's those people that I work with every day who ensure that that care is the best that we can give.
I think the personal connection with the patients is what inspires me to come here. I truly love what I do, and coming here and knowing that I made a difference when I go home at the end of the day. I've sat at patients' bedsides, while they took their last breath and, comforted their family, and those are the moments that really count when it all comes down to it.
For me, there's a lot of satisfaction when I can find a cancer at its earliest stage before a woman can even feel it, before she has to go through chemotherapy or radiation, and the cancer can be removed completely with surgery. That's very satisfying to me. And it's always very, very satisfying when I see a patient come back for a 6-month follow-up or a year follow-up or a couple years from now, and they're cancer-free.
We have some high-quality docs who could be anywhere, but they choose to be in this area because they like our patient population, they like what we do, they like trauma, they like the sick patients that we see. And so just having a good team around you actually enables you to be the best ER that you can.
They can't do anything without supplies. So, it's very important that we take care of every unit, every patient, every day. Methodist Hospital is a great institution. Like when I walk into my car knowing that I made a difference, it means a lot to me.
We're doing much better with the food. We're doing a lot better food items. We're giving a better selection of food for our physicians. I come to work each day at Methodist because I'm committed to making our guests happy, having them say, wow, that was a great meal.
Knowing that here there's a new challenge. Each day is something new, something different than the day before. By me making sure that my generators are ready, operational, and things of that nature. So if we did have a situation, I know that I would be able to sustain the hospital electrically.
We've seen a lot of improvements in the areas of quality and patient safety in our departmental operations. We've been involved in national initiatives, and we've actually achieved those goals that we wanted to see.
There's been a lot of changes in the hospital in the sense that we're growing really strong in our community services, and we're providing a lot of ideas. Instead of just helping people get well, we're also outreaching for wellness, trying to get people to stay well.
Methodist hospitals, they really add a dimension that the Y could not add otherwise. They really get to know our members. They get to know the people that come into the Y, and really not only our members, but the community that comes in for our screenings or for doctor's appointments.
The free screenings have gone over so well. Sometimes screening and things they can't get, or they can't get to a hospital, or they can't get to a doctor, but being able to put it somewhere where they come on a regular basis gives them an opportunity to take advantage and be proactive in taking care of themselves.
Methodist is genuinely interested in our youth. They're not isolated. They reach out. They want to encompass the community, the students. They want to provide for the future of Methodist Hospital by giving interns the opportunity to learn what it's about.
As the director of the Gary Literacy Coalition, the Methodist Hospital as well as the Literacy Coalition realize that literacy goes hand in hand with healthcare. Reading is the best medicine.
We're working really hard toward improving our patient experience, and most of our patients will tell you that they've seen a change in the climate here at Methodist with regards to making sure that our patients are happy.
We have the tenacity of a pit bull, and we continue to push as far as we can, as long as we can, for whatever the patient needs.
We not only treat our patient symptoms, but I believe we treat the person. We're constantly growing and getting better with our patient care. And each and every year I've been here, I see the vision that the executive team and the board members have put in place for Methodist, working each and every day through our interaction with our patients, through the interaction with our coworkers, through our patient care. So I do see the vision coming to pass.
Hello, I'm Ray Grady, Methodist Hospitals President and CEO. At its core, Methodist Hospitals is blessed to have a proud, dedicated, and passionate workforce. Each day, I see examples of the hard work and commitment that enabled Methodist Hospitals to stabilize its financial health. Now, we must all summon that same strength to ensure that Methodist Hospitals thrives in tomorrow's healthcare environment. Although we're a nonprofit institution, we do have shareholders. Our shareholders are the patients and families who come to us for care. And every day and every time we improve the health of one person or our community as a whole, we pay real dividends to those very shareholders, our neighbors, our friends, our families.
Thanks to the dedication and expertise of our doctors, nurses, and staff, Methodist Hospitals truly is leading the way to better health.